Okay guys, so let's come to cell injury first. What all can be asked to you? So whenever I'm talking about cell injury, remember what is the most important cause of cell injury? So cell is like a miniature human being. If you want to kill the cell, stop its oxygen, isn't it? So the most common cause of cell injury is hypoxia, right? So as soon as you cause hypoxia, automatically the oxygen is going to reduce, and oxygen is most important for oxidative phosphorylation. Okay, so this is the main mode of respiration. So once the oxidative phosphorylation stops, your ATP is going to fall down. So when the ATP decreases, this basically leads to stopping of functioning of sodium-potassium ATPase pumps. And when these pumps stop, what is going to happen is, so whenever these pumps stop, what is going to happen is that obviously these pumps are the most important pumps which help in sodium and water balance. So when these pumps stop, the sodium is going to come inside, the water is going to come inside, and the cell will start undergoing swelling. That is why the first morphological change, morphology means something which you can see under the microscope. The first morphological change of any cellular injury is swelling. So this swelling is because of water which has come inside because of stoppage of the pumps. That is why this swelling is also called as hydropic change. Okay, so this is also called hydropic change. It has been given different names in different organs. Like in liver, it is called as ballooning. So first morphological change which is seen in viral hepatitis is ballooning. So that is one thing which you should be very, very clear. Now, the important point, what causes hypoxia? See, hypoxia most commonly is caused by when you decrease the blood supply to the tissue, automatically less blood flows, less oxygen also goes. So the most common cause of hypoxia is ischemia. The second important cause is decreased oxygen carrying capacity of the blood. So blood is going, but it's not carrying the oxygen. So that is anemia. That's the second important cause. And the third is cardiorespiratory arrest. So heart is not pumping, respiratory system is not oxygenating. All that is causing hypoxia. So that is what is important causes of hypoxia, which we should be clear. So that is the most important effects of hypoxia. So the most common cause of hypoxia is ischemia, when the blood supply to the heart is, when the blood supply to the tissue is decreased. And of course, the first morphological change that you see under the microscope is hydropic change. Now, what else is seen? See, when the oxidative phosphorylation is stopped, the alternate mode of respiration is glycolysis. So whenever there is glycolysis, okay, that's an alternative mode of respiration. So glycolysis produces a lot of lactic acid. So this lactic acid means H ions in the cells are going to increase. So this is very important because acid always causes mild chromatin condensation. So this causes mild chromatin condensation. But this is mild, that is why it's reversible. It is reversible. Okay, so mild chromatin condensation is reversible change that occurs. That's a reversible change. Why? Because if you start giving oxygen to the tissues, the oxidative phosphorylation will start and immediately the glycolysis will stop. So the acidity will reduce. Okay, so that is why all the changes till here, wherever we are studying, are reversible. If you give oxygen, everything is going to revert. Now, the second question, is the cell only swelling or organelle is also swelling? Everything is swelling. So when water comes inside the cell, so all the organelles also get swollen. Okay, are swollen. Now, one of the organelle which is very important here is your ribosomes. So when the swelling occurs in the ribosome, the two subunits get separated. Okay, so because the two units are getting separated now, so the protein synthesis is going to decrease. So there is decreased protein synthesis. So when the protein synthesis decreases, compensatorily the cell starts showing you fatty change. The cells will start showing you fatty change. So this fatty change that you see is another feature which you can see in your reversible cell injury. So whenever we have reversible cell injury, always remember, reversible means if you give oxygen, it can be reverted. So if you give oxygen, the ribosomes will come close together and they will start protein synthesis and fats will disappear. So that is why can I say fatty change and hydropic change are two very important microscopic changes or morphological changes seen in reversible cell injury. So very important feature of reversible cell injury are hydropic change and fatty change. Okay, so they are seen in the microscope. Now, another point. So this is about what is happening inside the cell. What about outside the cell? So when the swell is swelling, so the microvilli on the top will also get lost because of swelling. So there will be loss of microvilli. There will be loss of microvilli. Sometimes so much water comes inside the cell that this leads to formation of blebs. So bleb formation starts. So this can be seen under electron microscopy. So if you look at electron microscopy, the microvilli are lost, the blebs are formed. That's a very classical feature of reversible cell injury. So if we have to make a gist, can we make a gist? What have we studied? So whenever we have cell injury, so first thing that happens is decreased oxidative phosphorylation, the pumps stop, so water starts coming in cells, swelling occurs. The swelling is called hydropic change. There's loss of microvilli, bleb formation, all the organelles are also swollen, but ribosomes, though units get separated, so protein synthesis stop, compensatorily fat change is started. Apart from that, there's mild chromatin condensation. Now, one more thing here. So is water going inside the nucleus also? Yes, of course. So inside the nucleus also, this will cause disaggregation. This will cause disaggregation of granular and fibrillar elements. Okay, so this will cause disaggregation of granular and fibrillar elements of the nucleus. So that's another classical feature that you will see. Disaggregation of the granular and fibrillar elements of the nucleus. That's another classical feature that you will see in your injury. Okay, so in the nucleus also there's disaggregation of granular and fibrillar elements. That will be very classical elements. So if somebody asks you what are the nuclear changes which you see in a reversible cell injury, can I say you will see mild chromatin condensation and you will see disaggregation of the granular and fibrillar elements. These are classical reversible features seen in the nucleus. So these are the classical features which you see in cell injury and you should be very, very clear. Okay. So till here everything is reversible. Why? Because as soon as you give oxygen, everything reverts. Okay. Everything reverts. Now, one more point here, okay? So, when the cell is swelling, some of the phospholipids might even fall down, okay, in the cell. Some of the phospholipid might fall down in the cell. So, these phospholipids that fall down in the cytoplasm of the cell are called as myelin figures. So, myelin figures are nothing but phospholipid whorls. So, they are very few in number in reversible cell injury, okay? But they can be more in irreversible. Why? See, when the cell is swelling, one time will come when the cell membrane will get ruptured. Once your cell membrane gets ruptured, that's it, gone. Now all the calcium from outside will start coming into the cell. So as soon as the calcium comes into the cell, this organelle which will try to protect you is your mitochondria. It will try to take all the calcium within it. But after a point of time, when so much calcium is coming inside the mitochondria, this will lead to formation of mitochondrial permeability transition. This is very popularly called as MPT. This is formed in the inner layer of mitochondria. Now that's a very important point. Remember that. Inner layer of mitochondria. So later on you will be studying about apoptosis. So in apoptosis, BCL2 is present in the outer wall of the mitochondria. Cytochrome C comes from the inner layer, both in between the two layers of the mitochondria. So cytochrome C has a role in apoptosis. Okay, so changes which are occurring in apoptosis is in the outer wall of the mitochondria. When the inner wall of the mitochondria is damaged, that occurs in necrosis. Okay, now nobody can save it. The cell is going to die and it is going to die by necrosis. So this leads to formation of mitochondrial permeability transition, which will increase the permeability of the mitochondria. It will cause profound mitochondrial dysfunction. So then there is formation of large amorphous densities in the mitochondria. So this will lead to formation of large amorphous densities in the mitochondria. in the mitochondria. Now, this is a very, very important point. Once you see large amorphous densities in the mitochondria, that means there has been mitochondrial dysfunction and this cell is going to die by necrosis. So this membrane damage and profound mitochondrial dysfunction are the hallmarks of irreversible cell injury, which is going to progress into necrosis. That is, now the cell cannot be saved, it's going to go into necrosis. So once you see membrane damage and profound mitochondrial dysfunction, that's a hallmark of irreversible cell injury, and it is going to progress into necrosis. That's very, very classical here now. Okay, so now everybody clear with large amorphous densities? So somebody says small amorphous densities. Small amorphous densities can be seen in reversible cell injury also. But when they use this term large amorphous densities, this is because of formation of mitochondrial permeability transition, and this is due to excess calcium coming inside the mitochondria, and this interplay is a very classical feature of irreversibility. It's an irreversible cell injury. Now, not only the calcium will enter into the mitochondria, there will be a lot of calcium which will also, now once the mitochondrial permeability transition has formed, so all the calcium will be thrown out in the cytoplasm. So once the calcium comes into the cytoplasm, it will activate certain enzymes. So what are the enzymes it will activate? Please remember, it will activate PAPE group of enzymes, PAPE. It will activate PAPE group of enzymes. What is this PAPE? P for phospholipase. Phospholipase. A for ATPase. P for protease. E for endonuclease. So remember the rule. Whenever there is ACE behind anything, it is going to break that component only. So phospholipase is going to break down phospholipid. So although everything started because there was membrane damage, so now you're going to get more membrane damage. So you're going to get more membrane damage. So now nobody can save the cell. Apart from that, there are dedicated enzymes which are breaking the phospholipid. So there will be a lot of phospholipid whorls that will be formed, which are called as Myelin figures. So you're going to see a lot of Myelin figures here. So Myelin figures can be seen in reversible also, but predominantly they are seen in irreversible cell injury. ATPase is going to break down more ATP. Protease is going to break down the protein. So all your cytoskeletal is formed of protein. So this will cause cytoskeletal collapse. Now endonuclease is going to break the DNA of the cell. So how does it break? It breaks in 3 steps. So first there is pyknosis, that is the nucleus becomes very small. Then there is fragmentation of the nucleus, that is karyorrhexis. And then the nucleus dissolute. So when the nucleus becomes very small, like a dot, this is called pyknosis. Now when the nucleus disintegrates, then it is called, nucleus is called karyorrhexis, means fragmentation. So this is nuclear karyorrhexis. And finally the nucleus has dissolved. This is called karyolysis. That's a classical feature in the nucleus which is seen here. So can I say what are the features of irreversible cell injury now? So the hallmark of irreversible cell injury is membrane damage. This leads to calcium to come into the cell. It goes into the mitochondria, forms large amorphous densities, and at the same time mitochondrial permeability transition is formed from the inner layer. So this will cause increased permeability, and now all the calcium will be thrown into the cytoplasm, and it will activate PAPE group of enzyme. So PAPE is, it will activate phospholipase, which will break down phospholipids. So there will be a lot of Myelin figures. ATPase will be there. There will be cytoskeletal collapse, and endonuclease will activate. So the nucleus is also broken down. So because of all that, the cell is going to appear, because the nucleus is completely broken down. So cell is going to be more pink. You know, normally we stain any histopathology slide with hematoxylin and eosin. So hematoxylin stains the DNA and the RNA, and eosin stains the protein. So here the DNA is lost. Okay, not only that, RNase is also activated. Remember, RNAs are also activated, which will break down the RNA in the cytoplasm. So cytoplasmic RNA is also broken down. So there is no cytoplasmic RNA, there is no nuclear DNA. So this will make the cell appear very, very pink in color. So that's a classical features of irreversible cell injury, which you should be clear. So they can ask you what are the differences between the reversible and irreversible cell injury, and you should be super clear in answering that. Right, guys? Okay. So that is reversible and irreversible cell injury, which everybody should be very, very clear. Okay. If I'm saying, if somebody is asking, okay, what are the features of reversible cell injury versus irreversible cell injury? So remember, reversible cell injury, whenever I'm saying, okay, the cell membranes have to be intact. Okay, so this occurs because of stoppage of pump. So there is loss of microvilli. There is loss of microvilli, formation of blebs, which is very characteristic here. Then you see that all the cell gets swollen. Cell is swollen, okay, and this change is called hydropic change. All the organelles are swollen except ribosomes, where there is separation of the ribosomal subunits. So whenever there is separation of the ribosomes, compensatorily fatty change is going to start. And in the nucleus, we have two changes, that is disaggregation of the granular and fibrillar elements. And second, we have studied chromatin condensation, which is mild. Okay, if it becomes like a dot, it will be irreversible. Okay, so mild chromatin condensation. Okay, so these are the features of reversible. Irreversible, first feature is membrane is damaged. There are large amorphous densities. So these two are characteristic in the mitochondria. Okay, and then there is pyknosis. Nucleus becomes like a dot. So can I say this is marked chromatin condensation? So whenever they give you a term marked chromatin condensation, you have to remember this is for irreversible cell injury. And then there is karyorrhexis, that is fragmentation of the nucleus. And then there is karyolysis, that is the nucleus completely dissolutes. So these are classical features of the irreversible cell injury. You should be very, very clear. Of course, do not forget Myelin figures. So Myelin figures are predominantly seen in irreversible but can be seen in reversible also. So they can be seen in both. Okay, so these are the characteristic differences between the reversible and irreversible cell injury. And now the irreversible cell injury is actually progressing into necrosis. So let's study about necrosis. What happens in necrosis? Let's see about it. Right. So before we go into necrosis, guys, let's see some images that can be asked in this. So look at this. So in this is the normal cell which should show you microvilli. So if there is loss of microvilli, so there's nothing here, but there is formation of blebs here. So once you see these are formation of blebs here. Okay. So formation of blebs is a very characteristic feature of reversible injury. So these are nothing but dust particles, ignore them. But otherwise the characteristic feature is there's no microvilli, there's bleb formation. This is reversible cell injury. Second electron microscopy that you should be clear is this. These are very typical how the cristae of the mitochondria appears. And look at here complete mitochondria has become like a balloon. It is distended, but there are no amorphous densities. So distension of the mitochondria is classical feature of reversible. If there are large amorphous densities, then it is irreversible. So look at the microscopy. Here the cells have become distended and they become very clearer because this is what is called hydropic change. This is because of more water coming into the cell. That is what is called as hydropic change. That you should be very clear. And this is the electron microscopy of Myelin figures. So they are nothing but phospholipids whorls. So they appear like as if somebody has cut the tree. So these are phospholipid whorls that are very typical here. Okay. So these are Myelin figures. Remember, Myelin figures are predominantly seen in irreversible injury, but some of them can even be seen in reversible. So you should be super clear with this. And this is what is a normal cell. Then pyknosis is like a dot, karyorrhexis is fragmentation, and karyolysis is complete dissolution. So that is what you have to know. So these are the images that you should know before we go to necrosis. Now, once we're clear with these images, now we can progress into necrosis and understand what all we need to know about it. Right, guys?